Hello everyone, my name is Henry Avetisian. I'm a research fellow at the USC Spine Center. I just wanted to thank the LSRS for the opportunity to present our poster entitled Staged versus Same-Day Circumferential Lumbar Fusion for Degenerative Disease, which is the safer approach. Beginning with the introduction, circumferential lumbar fusions have been shown to have better postoperative outcomes compared to posterior-only fusion techniques. And within the context of deformity surgery, the circumferential fusions are often staged where the anterior portion is complete on day one, followed by the posterior fusion on a separate day. This is usually done to take one long fusion and separate it out over 2 sessions just to decrease the physiological demand for both the patient and the spine surgeon. However, in the context of degenerative spine disease, it's not clear how often these are being utilized and what its short-term post-operative outcomes are, which are the main goals of this study. Moving on to the methods section, we utilized the PearlDiver National Database to identify our study cohort, which were composed of patients who underwent circumferential fusion for degenerative spine disease. We further stratified this cohort based on same-day surgery and stage surgery, where the anterior portion was complete on day one, followed by the posterior fusion within 2 weeks. We then analyzed the utilization trends from 2010 to 2022. We compared the baseline demographic differences between same-day and staged cohorts. And lastly, we used a multivariable regression analysis to determine the risk of 30-day postoperative complications, hospital readmissions, and revision rates at 1 to 2 years. Moving on to the results, we identified a total of 45,204 patients with 88.60% undergoing same-day fusions and 11.40% undergoing a staged procedure. Looking at this graph over here, it does look like the total number of cases of staged fusions have been increasing throughout the study period. However, if you put this into the context of the total number of circumferential fusions by year, we see that it's only increased by 3.55%, and it also plateaued after 2016. The staged cohort at baseline had higher comorbidity indices, obesity rates, as well as tobacco use. After controlling for these variables, we found that staged fusions were actually associated with a higher risk of 30-day complications and hospital readmissions with no differences in revision rates. Looking at this forest plot over here, it does break down the different complication groups that the staged group was at risk for. We just wanted to point out that it does affect multiple organ systems. Therefore, we conclude that staged fusions are utilized by a significant subset of spine surgeons for degenerative spine indications, and it's more often utilized in patients who are at higher risk and those requiring longer fusion constructs. We also found that it's associated with a higher complication profile compared to same-day procedures. However, we do have to put this within the context of a major limitation in that we were not able to identify which patients had a staged procedure pre-planned, or was it originally a same-day procedure and due to some intraoperative complication, it had to be staged. Therefore, with that in mind, further research is required to determine which patient population may benefit most from staging. Thank you for listening.